Hi, my name is John Gunstad, and I'm a neuropsychologist at Kent State University. Over the next few minutes, we're going to have the chance to extend our conversation about stress and obesity to include cognitive function. So hopefully, again, over the next few minutes, I'll be able to convince you that this is another important piece of this entire puzzle. I think a potential reason why cognitive function might be interesting is that it's going to help us bridge some of the basic science that we're hearing this morning and some of the clinical work this afternoon. And my talk is really going to be able to try to bridge those two separate pieces together. So we're going to talk a little bit about some kind of more basic underlying mechanisms on how these things might be related. And then we're going to talk about clinical implications. So with some luck, I'll have you convinced by the end that there might be a place for this one too. So in order to try to get there, I'm going to talk about kind of three broad areas. The first is how obesity is associated with cognitive deficits. So we've known for a long time that obesity is bad for the brain. We're going to talk a little about how and where that potentially happens. For the second part, we're going to talk about how stress potentially makes this worse. And in particular, we're going to talk about how acute and chronic stress might make these things especially bad. And the last part on here is we're going to talk about how some of these cognitive deficits actually lead to poorer clinical outcomes. And in particular, we're going to highlight some of our work showing that people with problems with memory or executive function actually are able to lose less weight after weight loss surgery. So let's get started. So the first place and the easiest place to get started is how obesity connects to the brain. And we've known for a long time that obesity tends to be bad for the brain. So we've known for a long time that obesity is linked to things like stroke, Alzheimer's disease, vascular dementia. More recent work really kind of extends this and kind of highlights some of these imaging findings that shows that individuals who are obese have smaller brains, so their brains appear to atrophy faster with age. They also show what are called white matter hyperintensities, or these tiny little strokes throughout the course of the brain. And we know that this process starts relatively early, as we can actually start detecting that when a person's in their 40s. Now, one of the challenges for this type of research is we know that obesity is often comorbid to other types of medical conditions that are also bad for the brain. So we know that persons who are obese are at high risk for things like hypertension, type 2 diabetes, sleep apnea, and so on. And in turn, all of these medical conditions are also bad for the brain. So it's a little bit hard to know if when obesity is connected to things like Alzheimer's disease, is it an independent effect, or is it actually through these other mechanisms, or is it some shared combination? So to disentangle that a little bit, our research group had the opportunity to take a look at individuals who are extremely healthy. So for this research project, and we'll talk about the findings here in just a second, we had the opportunity to work with what's called the Brain Resource International Database, or BRID. Individuals who are in the BRID have to be incredibly healthy, and quite honestly, it's some of the healthiest people you're probably ever going to find on the planet. In order to be included in this project, individuals have to be free from any type of medical condition, so no hypertension, diabetes, no allergies. Individuals have to have no psychiatric history, so no even history of anxiety disorders or depression. But to extend it one step further, they also cannot have any family members that have a history of neurological disorders or psychiatric disorders. So in effect, these are the healthiest of the healthy individuals. So when we have the opportunity to look at things like body mass index in this group, we know that body mass index in this case tends to be relatively independent of potentially these other type of comorbid conditions. So when we have the opportunity to take a look at the findings, what we actually find is a little bit interesting. As body mass index goes up, cognitive function goes down. And so for this first paper, we had the opportunity to take a look at both attention and executive function. So both of these are brain functions associated with kind of frontal brain regions. Attention includes things like concentration, processing speed, really kind of being kind of focused in the moment. Executive function is a little bit broader. This includes things like problem solving, abstract reasoning, cognitive inhibition. So kind of higher order mental abilities. But what we see when we take a look at the findings is a pretty clear case. In each case, as body mass index goes up, cognitive function goes down. But for those people who are a little bit stat savvy, you're going to take a look at this and realize that the effect sizes tend to be relatively small. And again, I completely agree, and that's one of the potential limitations of this. But then it's important to back up and realize, again, these are incredibly healthy individuals. No medical conditions, no psychiatric conditions, no sleep disturbance, nothing. The healthiest of the healthy. So even in this very, very rarefied group, we find that with elevated body mass index, cognitive function goes down. Now what's a little bit interesting, and something that was a little bit unexpected for us, is having the chance to take a look to see how these individuals might be looking over the course of the age span. So this study was cross-sectional. We had the chance to, again, look at a wide range of adults, people from the ages of 18 to kind of in the upper 60s. And what we find is that there's an independent effect of obesity across this entire range. So again, when we have a chance to look here, so we have the normal weight individuals in red, the overweight or obese individuals in black, and we find that at each time point, that really their performances tend to be equivalent. So with age, performance goes down, so sadly as all of us are getting a little bit older, our mental abilities are going to get a little bit worse in some areas. This is kind of a sad thing. But what we know is that obesity doesn't seem to interact with the aging process in this type of healthy sample. So when we look away, when we have the chance to step back from this again really kind of argues two separate points. So the first is that obesity across the lifespan is associated with reduced cognitive function. But independent of these comorbid conditions, it doesn't seem to have any type of additive effect. So again, in this rarefied group, there's an independent but consistent effect of obesity on the brain. When we have the chance to take a look at memory, we can actually see a very similar pattern then as well. So in this case, again, the individuals who are obese are in this red, kind of this red bar, individuals who are normal weight and overweight in the others. And again, we find very much the same pattern here. Obese individuals, those in this case with the highest BMI, do the poorest on this list learning task. So for this task, we give them a long list of words. They have to be able to remember it, and then over the course of time, be able to remember it at longer and longer delays. And again, what we find is the exact same pattern for both learning, recall, and recognition of these different list of words. So for individuals, again, with the highest BMI, they learn the least. Again, when you take the quick look at it, you'll see again that this effect is not whopping. It's not going to hit you over the head. It is about half of a standard deviation, which is, again, a good medium-sized effect. But again, these are individuals who are very, very rarefied. So no history of medical conditions, no hypertension, no diabetes, no sleep apnea, and yet this pattern still emerges. So if these patterns are going on in adults, and in kind of across the adult lifespan, what actually happens in younger persons? We know that the rates of childhood obesity are dramatically increasing, and it's a little bit unclear of how this is actually going to spell out for the brain in children who are developing. So once again, we had the opportunity to go back to that very healthy sample. So I think probably the way that this works out, those very healthy adults get together and have very healthy children. So again, the children in this case are incredibly healthy, no asthma, no chronic medical conditions, no allergies, essentially no medical conditions of any kind. And again, when we have the chance to take a look at this pattern, we find in this case, which is a little bit surprising, is that there's actually no relationship between BMI and cognitive test performance. So when we have a chance to look at the correlation coefficients over here, it's actually hard to get much smaller variation than this. We're essentially counting for none of the variance. So again, how and why this exactly happens is a bit unclear. But this may be one possibility that starts to argue that maybe there's an effect of duration or severity or other factors that might be important for understanding how obesity might be related to the brain. So though these children again had an elevated body mass index, their brain appears relatively intact. But if we have the chance to look at adolescents who are a little bit more obese, so in this case rather than an average BMI of 26, in this case with an average BMI of 54, we find that there's a different pattern. In this case, this is focusing on tests of attention and executive function once again. What we find in this case is that there's a very, very large effect in terms of cognitive impairment. So in each of these tests and the other ones we were able to administer, in each case, these obese adolescents performed more poorly than their normal weight peers. And again, all of them were roughly about one standard deviation or kind of an effect size of 1 below their counterparts. And again, this potentially provides a little bit of information. So in the last slide, where those overweight children weren't particularly overweight and super healthy, there was no pattern. But in this, with a higher BMI and with significant comorbidities, things like depression and hypertension were relatively common in this group, we actually find that there is an effect of obesity on the brain. So again, this makes that puzzle between duration and severity a little bit more complicated. To make it more complicated yet, we then looked at the other end of the life spectrum and looked at older adults. So for this project, we had the opportunity to look at persons who were in the Baltimore Longitudinal Study of Aging, or the BLSA, and we had the opportunity to look at individuals for over a period of time. So again, the last few studies were fairly limited in that they were cross-sectional. It gives us some information about how obesity might be affecting the brain currently, but it tells us very, very little about their past history, or what actually may happen in the future. So for this study, we had the opportunity again to look at about 1,700 individuals starting around age 55. Now it's important to note for this study that we had the chance to follow individuals for 3 separate visits. For this project, that works out to be about 9 or 10 years on average. So that gives us the chance to follow people from ages of 55 to about 65. As a neuropsychologist, I'm particularly interested in looking at this group, as we know that the rates of Alzheimer's disease spike very, very rapidly starting around age 65. It's almost negligible before 65 and jumps to 5 to 10% after the age of 65. So by following people from the age of 55 to 65, we might be catching them kind of in this sweet spot, such as it is, where we're able to then be able to see, does obesity potentially relate to cognitive decline, or is it at least some type of accelerated brain aging? So again, we have the chance to kind of follow them. The population is again very well balanced, with a good mix of both female and minority participants. So the short version is, in terms of these findings, they got very, very muddy. And unfortunately, it made things actually more confusing than it really kind of raises more question than it actually answers. So when we look at main effects, as body mass index or waist circumference or waist hip ratio go up, we find that there's a mix of findings. Some mental abilities get better, some of them get worse. To make this even more complicated, when we look down at the interaction term down here at the bottom, this actually again kind of gets more complicated still. We're finding that as obesity indices go up, executive function gets worse, but as obesity indices go up, attention actually gets better. Now, without a long collection of time on neuroanatomy, this is particularly complicated because it's believed that both attention and executive function come from very much the same brain regions. So in effect, this type of data really argues that somehow obesity is both protective and harmful for the exact same brain region. And quite simply, we know that that can't be the case. We know that there has to be some important element here that we're missing. And what those elements may potentially be are found right here. We know that there's a lot of conceptual information that we haven't been able to take into account in these initial studies. So one is, again, the potential effect of severity. One possibility is that there's a dose-response relationship between obesity and bad brain outcomes. So potentially with a higher BMI, that's just going to lead to bad brain outcomes regardless of what else is going on. But there also is the possibility of something like a threshold effect. Maybe a BMI of 30 is a little bit bad for the brain, but maybe a BMI of 40 is catastrophic. Studies really haven't had the chance to start teasing these things apart of how there might be a nonlinear relationship kind of hiding in between here. Another possibility is, again, this idea of a duration effect. So one possibility, and this seems fairly likely, that if a person's obese for a longer period of time, that it actually may do more harm to the brain. So if 1 year is bad, 10 years is really bad, 30 years is horrible for the brain. But there's also the possibility in terms of duration effects that there might be some type of, once you've been obese, that it never really fully undoes the damage. That any exposure potentially leaves some type of permanent effect on the brain that leads to bad outcomes down the line. And again, we just simply don't know that quite yet. Another potential spot where this becomes complicated is the idea of age effects. So again, we've seen very, very mixed findings in young adults and in adolescents and in children, where there seems to be some effect of severity, potentially some effect of time, but again, this is very, very muddy. And in older adults, it gets even more complicated. So again, there's a whole lot of work that really needs to be done to kind of better disentangle some of these pieces. And why there's potential value in looking how cognition might be important and how cognition and obesity might be related in this group is really in terms of the clinical outcomes. So recent work from our group and from others have shown that individuals with problems with memory, executive function, other types of mental abilities have a harder time losing weight. So for this study, the one that's listed up on top, we had the opportunity to test people prior to bariatric surgery and then follow them for the first 3 years after. And at these annual visits, we're able to look at cognitive function again, but also be able to get things like height and weight and blood pressure and all those other good types of medical comorbidities. So what we're finding is a little bit surprising, that individuals with poor memory and poor executive functioning at baseline have a harder time keeping that weight off. And we again are able to start seeing this at 12 months, but this effect becomes much, much larger at 24 months. In fact, when we look at a 24-month outcome, cognitive function accounts for about 25% of the variance and total weight loss at that time point. So that's independent of the effects of age, other types of medical conditions, motivation to lose weight, social support, all those other good factors. So memory, executive functioning, attention are accounting for about 25% of that variance, which was striking. And at this point, again, kind of the first ones to be able to kind of note that. And as we'll see here in a couple more slides, there might be good reason for this. But if this is happening even in persons who have weight loss surgery, it's perhaps not surprising that we see a same pattern in individuals who are going through behavioral weight loss. In general, if you have more cognitive impairment, your ability to lose weight is hindered. So the question that comes up for something like that is, how does that potentially happen? So one potential explanation is knowledge. If individuals have problems with memory, maybe they have a hard time learning the rules. So they have a hard time learning about nutrition or learning nutrition facts or how to implement exercise on a daily basis. Knowledge might be part of it, but perhaps more likely is this idea of self-regulation and planning. Now, much more likely than just simply unable to remember the words or kind of unable to remember the strategies, it's much more likely that these people have a hard time implementing them into their everyday life. So if a person has a hard time with planning or monitoring their activities, it may be very, very difficult to plan out their day and kind of restructure their life in order to fit in physical activity every day, or at least 5 to 7 times per week. Same way the person may have a harder time remembering to pack fruit for a snack rather than having to run down to the vending machines in the afternoon when they're too hungry to finish off the workday. So it's maybe this idea of problem solving, of planning, of monitoring that really becomes kind of much more important. And we have some preliminary evidence for this. We're not going to show it because it's just under submission now. And we actually find this exact same pattern. So we find that individuals who are going through bariatric surgery, as their cognitive impairment goes up, their ability to adhere to those medical guidelines goes down dramatically. And again, it goes down on those things that you might imagine it to be. So including things like being able to fit exercise in their everyday life, being able to meal plan appropriately, be able to identify the accurate portion sizes for different types of foods. All these higher order mental abilities are more impaired in this individuals, and it then directly leads to their inability to do this in their everyday life. So again, that really argues that there's a potential place for looking how cognition might be related to obesity, not just in terms of a consequence, but maybe also as a cause. So again, a further way that we're able to then kind of extend this into the kind of the real world settings is seeing how this plays out in everyday life. So in addition to our work, other work's been recently kind of published showing a very similar effect. So as individuals have more problems with cognitive inhibition, so the problem of difficulties kind of blocking out distracting thoughts or remaining on task, they're much more likely to have problems with disinhibited eating. And again, this makes intuitive sense that an individual has a hard time focusing and getting rid of distractors might have the same problems in being able to kind of manage their impulses or manage their controls over the course of time. So how does this all tie together, and why is this potentially important for stress? Well, we've known for a long time, there's a considerable literature that shows that when people are under stress, cognitive function gets worse. And it gets worse very, very rapidly. It doesn't matter whether it's physical stress, environmental stress, mental stress, our abilities to do things fall apart. So again, kind of a simple example for these sorts of things, if an individual is in a car crash, or again, they're about to be bumping into somebody else's car, they sometimes feel as though they freeze up. That in the moment, they could potentially know what they need to do, but they lock up. They have brain freeze. Another type of freeze that we look to be able to kind of work on is the effects of physical stressors on cognitive abilities. So for this study, we had the opportunity to bring people in this case, rather than looking at mental stress, we just made them very, very cold. So these individuals are sitting in their swimming suits. This room is right around 36, 37 degrees, and they have the opportunity then to sit in there for several hours. So don't worry, we have IRB approval, they were paid very well, they're undergraduates, they work for cheap, they're young and they're healthy, and everyone survived the project without any trouble. But what we found in this project is actually a little bit interesting. So as individuals come into the study, their cognitive function gets worse dramatically. And it gets worse in the way that you might imagine. So mental abilities like attention, executive functioning, and memory start to fall apart pretty quickly. In terms of the cold, we're able to start seeing effects as soon as about half hour, 40 minutes in. As their body temperature starts to drop, mental abilities also start to drop. But, and here's the most interesting thing, just before they're done, so they've now been sitting in this very cold room for several hours, they can think of nothing better than wanting to get out of this room, warm up, and go home. So at their coldest point, we give them cognitive testing one last time right before they have a chance to leave. And what we find is that cognitive function improves, and actually improves to near baseline levels, which again is fairly remarkable. At that point, they've now been in this room for several hours. Their body temperature is lower than it's probably ever been for some of these individuals. They're shivering in many cases. Despite all this physical stress, despite their body being under significant levels of strain, cognitive function bounces back to normal. Again, really arguing that there's some complex interaction between physical and mental stress that plays itself out in terms of cognitive functioning. Now, how this all comes together for persons who are obese happens in their everyday life. We know that individuals who are obese have a significant number of physical stressors and mental stressors that might get in their way. So in terms of physical stressors, we know they have, again, significant levels of inflammatory markers, they have disruption of the autonomic nervous system, there's insulin resistance, variety of medical conditions, poor sleep, significant pain due to osteoarthritis and other conditions, and so on. So their body is under constant strain or constant stress. And we see a lot of the same things in terms of their psychological stress as well. So in addition to the kind of the pressure of wanting to lose weight or concerns about this or depressive thoughts or ruminations about these sorts of things, these individuals are at higher risk for trauma or abuse. They may have significant stigma and kind of prejudice in their everyday life, more significant levels of pain, fatigue, and so on. So again, when we take these two things in combination, we find that individuals who are obese have cognitive difficulties, but now by being under greater levels of stress, their cognitive performance might be suppressed even more. So you can almost imagine in a weird sort of way, individuals who are at higher risk for weight regain after they've lost weight are the people with poor cognitive impairment or elevated stress. And there's some work that's actually just kind of shown. A pilot study just got published that showed that individuals who had gone through essentially a stress reduction paradigm were better able to maintain weight loss over the course of time. And again, kind of seeing these patterns and seeing how cognition might be connected, that's not surprising. Again, what's most likely going on is they're, because of stress management, perhaps better able to kind of maintain cognitive functioning in the face of temptation. So by being able to reduce stress at the end of the day, they're better able to kind of avoid the bad or unhealthy food choices and adopt something that's a little bit better or a little bit cleaner. How and why this happens, there's probably a couple different reasons. The first and potentially the most important, you're going to hear all about here over the next couple of minutes. Again, you're going to have the chance to hear realistically a very compelling talk on how this stress and obesity might be directly affecting the brain to change things like impulsivity, food cravings, the ability to kind of make good decisions over the course of time. So in kind of skipping over some of the biology, which is going to be talked by and presented by somebody much more expert than me, I'm going to have the chance to kind of jump forward and look at this from a clinical perspective and try to tie these pieces together to kind of better bridge them. And one potential way I think we might be able to do that is, again, kind of flashing back to our own work in these people with bariatric surgery. So what we see in this figure, and I apologize, it's probably a little bit hard to see in the video, we have the opportunity to follow individuals' cognition over the course of time. So in this slide, we're actually following individuals for the first 36 months post-operatively. So what we're finding is after surgery, as we mentioned before, cognition dramatically gets better. So this process of losing weight, of being able to kind of start shedding some of these medical conditions, cognition gets better. It gets better in things like memory in particular, but things like executive function, attention, a lot of other abilities improve. But what's more interesting is when we follow these patients over the course of time. So as we get out to about 24 months, the vast majority of patients are going to reach their nadir weight, their lowest weight at about between 18 and 24 months. And then at that point, they start to regain weight. What we're finding at this most distant time point, and again, this is all preliminary, so if you happen to review these findings here in the next couple of weeks, please be gentle. When we're looking at these findings, it's really two parts. So first up, the individuals who had the poorest cognitive function at baseline are showing also the most dramatic decline. So those individuals who are impaired here, as we follow them over the course of time, they're much more likely to be impaired here as well. But the interesting piece is what happens between 24 and 36 months. The individuals who are showing the greatest cognitive decline are also those individuals who are showing the most weight gain. So again, it very much argues that there's some type of cycle, that there's a bidirectional relationship between cognitive abilities and obesity. As obesity goes up, cognitive function goes down. And again, so in addition to just these effects on memory and attention and executive functioning, it seems to have real-world impact. So a person who has a gradual increase in weight is also going to have a harder time inhibiting. They're going to be more impulsive over the course of time or make poorer decisions over time, making them more likely to gain weight, have more memory problems, gain more weight, and so on and so on. So what do we potentially do about that? So I'm going to argue that there's probably two things we can potentially do. So the first one on here is really just start to look at cognitive function in more studies of weight loss. So look at individuals who are going through behavioral weight loss through surgical procedures, and so on, and be able to start to screen out in terms of cognitive impairment. We know that the prevalence rate tends to be fairly high. In our sample of individuals going through weight loss surgery, we found that 25% were clinically impaired. So again, equivalent to persons who are with known and documented memory impairment. But if we look at subclinical levels of impairment, that jumps to nearly 50%. So almost 1 in 2 individuals coming through had some type of deficit that we could detect on testing, which means that this is much more prevalent and much more of a concern than we were initially thinking. Another piece that we can potentially do is take this information from the screening and do something with it. So something that we're just started to be able to kind of tease apart in our lab is it possible to tailor weight loss interventions to individuals with better or poorer cognitive function? And one potential way that we're thinking about it in kind of a simplistic way is that those individuals who are more impaired are going to need more help, that they're going to need more structure, they're going to need more help in implementing things like physical activity, dietary strategies in their everyday life. So rather than sending them home with a set of guidelines and hoping they'll figure it out, actually sending them home with a schedule, sending them home with a grocery list, sending them home with a meal plan for a given period of time. So rather than having to think of the plan and then enact it, it's simply just their job to be able to kind of follow that plan along. By the same token, for those individuals who are less impaired, potentially we can just provide them with the information and then just provide support in order to kind of help them accomplish their goals. Because again, what we found again during our very, very preliminary studies is those individuals who are bright and who have good cognitive abilities, the more structure we impose on them, the more likely they are to resist. So in a weird sort of way, it can actually be a little bit frustrating for them when we try to plan out their everyday life. They feel as though, I can do this by myself, I don't need your help, back off. And so for those individuals, again, the very, very preliminary data suggests that those individuals may need something that's a little bit less structured or less scripted in order for them to be able to kind of achieve their best weight loss. The last little part, kind of tying kind of these pieces together, is we're still very new to this, and we're very much looking for collaborators. So here's a quick moment of a sales pitch. If you're potentially interested in this as well, please let us know. You guys are, again, will bring expertise to the table that we simply don't have. We're kind of muddling our way through, coming from the kind of the brain side of all of this. But again, it's potentially a very, very interesting kind of a new approach to better understanding how cognition might be related to both stress outcomes and obese outcomes. It might tie all these pieces together. Just the last 2 quick slides. So first up, all research involves many individuals. There's lots of people to thank. NIH, labs, the Baltimore Longitudinal Study of Aging, all the people who've been collaborating on all the projects. And then kind of the last piece on here, and this is included in your materials as well. Again, I'm very sorry I'm not able to be there today, but I'm very eager for the possibility of talking with many of you about your research and how we might be able to actually collaborate on some different projects. If you might be interested, or at the very least, if you want to kind of call me a bad name or identify how I'm wrong, here's my contact information. Please don't hesitate to let me know. So again, thank you very much for the opportunity to be with everybody here today, even if it's kind of in this weird way. And with some luck, I'll be actually able to answer a couple of questions through Skype in just a minute. So thank you very much.